Hello and welcome to We the People. Antibiotics are important drugs. Antibiotics are one of the greatest advances in medicine. Many antibiotics can successfully treat bacterial infections, they can prevent the spread of disease, and they can reduce serious disease complications. However, antibiotics can also harm you if used improperly or if overused. And now, you may be thinking that this is a known fact. You may be wondering, why are we talking about this on We the People? Well, take a look at this. The latest Lancet study says that Indians are overusing antibiotics, that we are using them without proper guidance, and this inappropriate antibiotic use is creating a worrying antibiotic resistance. In new research conducted by the Lancet Regional Health Southeast Asia has found out that India is the largest antibiotic consumer in the world when it comes to absolute volumes. But despite that, there is no formal system of antibiotic use like surveillance, any checks and balances systems in place like we have in the US and Europe. And that's not all. The WHO, the World Health Organization, has also warned that antibiotic resistance is one of the world's most urgent health problems right now. So I hope that answers your question. That's why we're talking about this on our show today, because it affects us, we the people. And joining us for more on this is Dr. Shafi Fazluddin Koya, co-author of the Lancet study, a research fellow at Boston University, the School of Public Health in Massachusetts in the United States. We have Dr. Gagandeep Kang, a professor at the Christian Medical College in Vellore, co-author of Till We Win, India's Fight Against the COVID-19 Pandemic. We have Dr. S.K. Sareen, Vice Chancellor at ILBS, that's of course the Institute of Liver and Biliary Sciences here in the national capital. We have Dr. Rahul Pandit, Director of Critical Care at Fortis Hospitals in Mumbai, a member of the National COVID-19 Task Force, and we have Dr. Sunil Agar, Professor of Excellence at Community Medicine, member of the Lancet Commission on the COVID India Task Force. But Dr. Shafi Koya, first to you as a research fellow, a co-author of the Lancet study, thank you so much for joining us. What were when the findings came out, did they surprise you and your team? Why are they so worrying? Why should we all be concerned?
First of all, thank you for having me in your show tonight, discussing one of the very important public health problems that we should be discussing more frequently. This study that that was published by the Lancet Regional Southeast Asia Journal, we undertook this with an understanding that as a country we have a lot of inappropriate consumption of drugs in general and also antibiotics in particular, which is more important because as the world discussed, just next to climate change, antibiotic resistance or antimicrobial resistance is a great threat to the existence of human race. Of course, we had a lot of studies previously, but for the first time, we tried to use some of the globally accepted measures like the Access Watch reserve categorization along with a standard measure, irrespective of different package size and strength that we see in the Indian market. So that's the particularity of our study that we would like to put across. So of course we found there's a large volume of inappropriate use of newer molecules and products that should be used sparingly. But we also found that we have a reason or we have a scope to improve it if we come up with some more better regulatory frameworks. I think that's a plus point. So we have a chance to improve the situation. So
we can still turn this around, you're saying?
It's that's not exactly.
Okay, fascinating. I want to get to that. But Dr. Sareen, we are I'm not sure if this is the right word, sensational statement here. We have Dr. Koya saying that, this is akin to climate change. It's as serious as climate change. So Dr. Sareen, if you could explain to us, again, just a reminder here, this is our viewers, we need to speak in like layman terms, simplify things for our viewers because this is serious. We want to understand why it is. What is this bacterial resistance then or antibiotic resistance, and why is it a threat to global public health, as the WHO says and Dr. Koya says it's as serious as climate change?
Thank you, Sarah, for raising this point at a public forum like We the People. And I think I agree with Dr. Shafi that it is as probably important as climate change. Let's understand where do these bacteria come from. Each one of us has in our intestines about 1.5 kilograms of bacteria. They are commensals. They are our friends. They are the ones, these bacteria process your food and make it usable. They extract the energy from the food. So they are good for us. But we spoil them, and we spoil them by using antibiotics right from childhood. A little bit of cough and cold, and the mom and the doc, they give antibiotics to the child, and this goes throughout. And this is very common in our country. So when you use an antibiotic, some of the good friends also die with the bad bugs. And the bugs keep changing in their own systems. So you're all aware of the COVID system. There is a resistance, the vaccines don't work. How one part of the virus goes to the other, and they join and they make a new. That's a mutant. If you give antibiotics off and on, the bacteria which you have, they change, they become resistant, and they will not work when you give the same antibiotic next time. So in simple terms, antibiotic resistance develops from misuse, and sometimes you don't take a full course. Half use, repeated use, using a friend's prescription. He has taken this, so I also take it. So this kind of an approach, when you are not using the right drug for the correct pathogenic bacteria, and 30 to 50% of our prescriptions are unnecessary or are smaller in quantity, smaller in duration, unnecessary. Because of all this, our intestinal bacteria change. Now, how do they get out from intestine? They get out into the blood. If you are taking, I shouldn't say alcohol or something, a beverage which causes leakiness of your gut. So your gut is a tight compartment. Yeah. From this, the bacteria cannot go. But if they go out, they go into your system, and slowly with different kinds of antibiotic repeated usages, they become superbugs. They won't at all work, and the antibiotics become useless for us.
So they kind of become like a mutant, strange strain, and nothing you throw at them, no medicine you throw at them works. You have to keep discovering or coming up with new medication, which we obviously
You are responsible. You're yourself responsible.
No, wait. You're saying you are responsible. Let me bring in Dr. Kang over here. Dr. Kang, I find this very worrying because, can't we assume that we, the people, when we go to a doctor, the doctor tells us what we're supposed to do, what we need to do, and that's what we do. I mean, are we also supposed to now be informed on our own? This informed, to be reading up, to be aware of what the Lancet studies, etc. are saying. Why are we who is responsible? Dr.
I think that antibiotics need to be really restricted. If your doctor gives you 2 antibiotics as an outpatient, change your doctor and your antibiotic. But that's easy to say, harder to do, because frequently people don't even know what is and is not an antibiotic. So the general principle is, if you have a fever for less than 3 days, if you have respiratory symptoms and you're not bringing up anything that does not look yellow or green, do not take an antibiotic. If you have diarrhea, do not take an antibiotic. They are completely unnecessary. Most of these infections are caused by viruses, and they will clear up by themselves. Antibiotics need to be taken under supervision. And some of the argument that is made for free access to antibiotics in India is that in remote locations, for example, children could get very sick and could die if we did not make antibiotics very freely available. But those antibiotics that are made freely available need to be a very restricted set of antibiotics. Instead, we have access to the highest end antibiotics in pharmacies across the country. So what we really need is regulation and control of antibiotics, the way we control opiates, for example. And that is simply not being done.
So I just want to understand this again. I think something very important and that maybe many of us have forgotten, because I know that this is flu season, and especially parents, we are dealing with children who have got either swine flu, or there's dengue, or there's hand, foot and mouth. I mean, this is of course over and above COVID. We don't know whether it's COVID. So in the middle of all of this, there are these flus, and parents are just trying to fix their kids, and we go to doctors, and many of them are perhaps taking antibiotics. So what Dr. Garg is saying, what ma'am just said over there, Dr. Dang, is that if you have 3 days of fever, it's okay. We don't have to throw medicines at yourself. I think that's basically what doctor is saying over there. Dr. Kang was trying to say to all of us over there. But do I have Dr. Pandit, Dr. Rahul Pandit? Okay. So Dr. Sareen, then to you first, because according to the Center for Diseases Control and Prevention, about 1/3 of antibiotic use in people is not needed or appropriate, which is also what Dr. Kang was just saying over there. But the researchers at Boston University and the Public Health Foundation of India in this study have said, they've pointed out to two drugs, erythromycin 500 mg as a tablet. They say that is the most consumed antibiotic formulation, followed by cefixime 200. Can you just for the lay viewer watching, what are they used for? What advice would you have to any one of our viewers who may be watching the show and realizing that they may be on this and perhaps are not using it appropriately? What are these two drugs used for? Why are they so commonly used?
The common infections in India, the azithromycin or cefixime, these are very commonly used drugs. And they are we must know how the antibiotics work first. The antibiotics work by penetrating the wall of the bacteria, changing its metabolites, changing the way the bacteria forms.
Yeah.
So all these antibiotics work like that. And this is the first antibiotic from the time of penicillin. This is the way they work. Now, the two antibiotics that people are using, they were used very often in the COVID times, which were not really required. That's a virus that is causing your infection, and viruses are not treated by antibiotics. Viruses can allow other bacteria to get in, but that doesn't occur at all. So it is clear that antibiotics are misused, overused, and I totally agree with Dr. Kang that first 3 days we don't just give paracetamol and see how it works, and your body has resistance enough. Body makes its own antibiotics and can kill them clearly. And secondly, if you are given an antibiotic, please ask your doctor, is it specific? The country lacks rapid antibiotic testing devices. Sensitivity to a drug is required, and we don't have it. Takes 2 to 3 days. So what doctors would do, you go for cough and cold, they will send urine culture and sensitivity. It will come in 3 days' time. You give your sputum, it comes in 2-3 days' time. By that time, you have fever, so you're worried. So one of the doctors will prescribe an antibiotic, which in my mind is not necessary. Only if you have a specific bug, you treat that bug. In the US, every prescription of a doctor, especially for high-end antibiotics, is monitored. You'll lose your license. But here we overprescribe.
And we don't have that system of checks and balances. But again, I wish I had one of those, graphics that would boom in and out, myth versus fact. So there's a myth over there. Let's try and bust that. What doctor has just pointed out, antibiotics are not to be given for viruses. I feel a little silly also just repeating this, because I think this is something we should all know, especially as parents, especially as full-grown adults. But clearly that's not the case. If you look at this study that's come out saying that Indians are misusing, and we're the biggest misusers of antibiotics globally. So do not give antibiotics for viruses. The body's immune system can fight off some viruses. Others like colds, all our doctors, these are the experts, biggest experts in the country. They're saying colds, coughs just need to run their own courses, and antibiotics do not work against viruses. Let's bring in Dr. Rahul Pandit does join us. Now we finally have him. So, Dr. Pandit, what happens? What happens if you do overuse or wrongly use antibiotics? Does that also have side effects? What does this mean for you? What does this mean for all of us, as a community?
Yeah, good evening. Thank you very much for having me on the show. So it's not just that we are over prescribing antibiotics. When we are actually consuming them, we are consuming them in inadequate doses and inadequate duration, and probably the wrong antibiotic for the bug. That's the first problem. I agree with Dr. Sareen and Dr. Kang that for viruses, we really don't need to have any antibiotics to be prescribed. The problem is somebody like me who works purely in intensive care unit. Right now, when I get a patient who is critically ill and is referred to me from a secondary or a primary center, majority of the time, the highest antibiotic has already been given to him or her few days ago. And that really leaves us with very few options to actually use. And when we do get culture and sensitivity positive on these patients, many a times, majority of the antibiotics are resistant. And then we have to really work hard to go back to some of the antibiotics which we were using, say, 2 or 3 decades ago. Something like colistin, which has been the polymyxin group of antibiotic, which was used several decades ago, is now something we have started using quite regularly for the last 8 to 10 years in our ICU. And people are moving and looking at various other antibiotics which could be useful for these multi-drug resistant organisms, because by the time they reach ICU, they are already into organ dysfunction, sometimes unfortunately multi-organ dysfunction. So we don't have a lot of time, and there is no luxury available with us to get a quick understanding of what the resistant pattern is going to be. So we need to have good tools to understand what the resistant pattern is. Something is coming up in terms of the PCR based techniques, which we are now having it, but it's very expensive and probably out of reach for many of our countrymen. The second problem is that when these patients do come and we do use a combination of antibiotics, they have their own problems. Sometimes with the combination, we actually give them some bacteria or some problems like Clostridium difficile, for example, which may worsen the gut and the flora of the gut, which Dr. Sareen was so nicely alluding to, and make us more sicker than what we were. So everything actually is a jigsaw, and the jigsaw needs to be solved at the bottom level, which is stop the prescription of antibiotics, so that when we move across in the forward direction, we will be right.
You're basically complicating matters, making things. So if I can just sum up, please correct me, just cut in if I'm wrong. So you're saying this would lead to more serious illnesses, longer recoveries, more frequent, longer hospital stays, clearly in ICU, and more expensive treatment also.
And perhaps mortalities as well as complications of the multiple antibiotics which we will be using. Now I work also in Australia for 2 weeks in a year. If I have to prescribe anything more than a first generation antibiotic, even as an ICU specialist, I have to take the permission of ID specialist. That's the kind of prescription policies we need to bring in, so that checks are put in on people who can be prescribing and who could not be prescribing.
Dr. Sunila Garg, why do we not have these checks and balances in place? I mean, the irony is we have a panel of doctors, and all the doctors are saying that this is a huge problem we have in India, but it's actually doctors who are prescribing this, and it's us. I mean, I think I'm a layperson. I go to my doctor, I do what my doctor tells me to do. I'm not deciding on my own what medicine to take or going to the pharmacist. So, Dr. Sunila Garg, please explain to us why in India is it that we are the largest consumers globally in terms of volume, but we have the weakest links, we have the weakest chains, no checks and balances, nobody's checking doctors, nobody's checking anyone.
Thank you, Sarah, first of all, for having me on the show. Number one, quickly coming to a point. Now, first of all, I'll tell you, India is the country where standard treatment guidelines are available with every medical council. But the lack of implementation and sensitization of providers is one of the important things. Another thing is that now we have got various categories of drugs. Something like when we are talking of antibiotics, antitubercular drugs or not, we have got H category of drugs, where, pharmacist is supposed to keep the prescription for 3 years, and these are kept in the red color box with the red border that is there. So this is one thing where the implementation part and drug inspectors have got a very, very important and critical role to play. That means one is on the part of sensitization of the providers to prescribe the drugs as per standard treatment guidelines. And also in our country, we see that mixopathy is quite very common. That's where, a person from one system of medicine will provide another system. So that's where the checks and balances are very, very important. So we need to, and we already have categorization of drugs which are, used for common illnesses, which are used in anti-narcotics and all that. and then we also have got this H category, H1 category of drugs. So this is which is most commonly misused. So we need to have, we should see that for every district we have, a district inspector. On an average, a district will have about 3,500 pharmacies. That is, and then, for them to be monitored, that is another thing which, we have to, kind of put the mechanisms in place so that, the pharmacy level is also checked and there is no prescription prescribed at the pharmacy level. Because sometimes people directly go to the pharmacy, they have their own doctors who just write the medicine. So that is another important thing which you have to keep in mind, that always whenever you have got another, that when you are going for a different illness or when you are going for a same, do consult your provider. That is one of the important things. And this is not, the world is sitting on the time bomb of antimicrobial resistance, I'll say. When we talk of Russia, when we talk of Brazil, when we talk of different regions within the world, but we are worried about India, let's say that. And then, we are the larger consumers of antibiotics. This is where rational use of antibiotics is very, very important.
Rational use is very important, but what is the government doing? What do we have in place? Let's get in Dr. Gagandeep Kang again. Dr. Kang, I mean, do we have the basic information? I mean, I'm not sure. I'm asking from the point of view of a layman, a public, an Aam Aadmi who falls sick. What is there to protect us in terms of informing us when we go to buy some medicine or to go to our doctors? Like, for example, do we even have information on our medicines that tell us what medicine is an antibiotic and what isn't? You buy a pack of cigarettes now, after all of these years, decades of fighting, you have that, big warning saying this is injurious or whatever. Do we even have that basic, simple literature to protect the people?
Yes, we do. And in fact, we have warnings that say that antibiotics should not be sold without a prescription. And yet they are widely sold without prescriptions. And this is the problem. It's not that we don't have the rules on paper. When it comes to antibiotic stewardship, to guidance for the appropriate use of antibiotics, we have reams and reams of guidance that has been published. But in terms of implementation of how people access antibiotics, not very much has been done.
Not very much has been done. Okay, lastly, Dr. Shafi, then to you, what quickly, 5 points, what do the public need to know going forward? This is flu season, we have dengue coming, this is in the north at least of the capital, we have all of these things being thrown around. What do we need to know? Top 5 tips before we wind up.
Before I just go into that, just to add to that discussion, we have to see that these things happen not in isolation. There's a lot of externalities. We have to have regulations. We have to have stewardship program for doctors to improve their prescription. We have to improve the supply of antibiotics through our public health system, which the government is definitely attempting to do, which will decrease the sort of prescription burden in the private sector, which is more unorganized. So for the common man, I would suggest a few things as you asked. First thing is as our esteemed panelists mentioned, for the initial 2-3 days of your cold or fever, try to take with paracetamol or home remedies and do not go for antibiotics. Second, when you go to a doctor to get an antibiotic, you go to a qualified doctor, which I know it's easy to say, it's not difficult, it's not easy and practical in many of our rural areas. Third, when you have a doctor, the doctors are also under pressure. We should know that when they do not prescribe an antibiotic, he is concerned that he doesn't know, he is not prescribing the right drug. So we need a cultural shift. We need a practical shift in this practice. When a doctor say you can politely ask, doctor, should we wait for a couple of days and start this? Or the doctor will be extremely happy if you ask that, and doctor will say, okay, it's good to wait for a couple of days before I'll give the prescription, but don't buy it now. So that, that develops a mutual trust, and doctors also feel confident not to prescribe more antibiotics when the patient come back. Fourth, pharmacy shops, they have a huge responsibility. Kindly refrain from giving an antibiotic, especially the broad spectrum and the newer antibiotics. See, linezolid, which is a very, antibiotic which has to be safely used. It is given out of every 1,000 antibiotics doses used, 8 is coming from linezolid. It's extremely dangerous. We need those antibiotics to be safe and to be used for extremely difficult patients. So pharmacist has the response. Government strengthen the regulations, include more antibiotics into the H1 schedule, which Doctor mentioned right now. We need more antibiotics to be included into that list, to expand the list of drugs which needs more stringent observation in terms of prescription and sales. Improve antibiotics in the public sector.
All right. Okay, Dr. Pandit, I think I can squeeze in another 30 seconds. So let me quickly ask you another point that I don't think we've touched upon enough. Basic fact, basic information for all of us, note to self. All of you were talking about, when you feel better, we say, okay, I'm feeling better now, I don't need to continue, because why put in all this medicine in my body? Why is that dangerous? It's always tempting to stop taking this antibiotic as soon as you start feeling better because you feel you're done. Why is that dangerous?
So when you consume half of your dose or you start feeling better and you stop it, you basically leave the bacteria untreated. And then what is going to happen is that this bacteria will now develop a resistance for this antibiotic. And next time when you have this infection again, or this infection, the present infection starts to worsen again, the same antibiotic will not work and you will have to go on to a higher one. And that way it will come to a point where most of the antibiotics will not act against a particular germ, and that's how the isolates will be present. So it's very, very dangerous to incomplete the dose. You need to complete the dose as per the doctor's prescription, even if you're feeling better.
Okay. Well, thank you all for joining us. We think this was a public service that we're all trying to do. We're also learning in the process. Just another reminder to everyone watching. Let's also remember that antibiotics helping drive up drug and hospital costs. The more antibiotic resistance spreads, we have more common antibiotics, including many that are available as generics that will now have to be retired. That means our treatment is going to get longer, more expensive. We're going to need longer treatment. So it's in all of our interests that we all act responsibly. But for that, we also need to be informed of this. So thank you all doctors for joining us on this show tonight and doing just that.